President Biden says the U.S. is buying 200 million more doses of COVID-19 vaccines and that they will be delivered this summer. His announcement comes as the U.S. reports more than 3,700 deaths on Tuesday. That is more than the previous 2 days combined. But the country is still slow to roll out the vaccines. The CDC is reporting more than 44.3 million doses have been distributed. However, a little over half have made it into the arms of Americans. Johns Hopkins University is reporting more than 426,000 people have died from the virus in the United States. The country is also reporting a total of more than 25.4 million infections. That accounts for a quarter of all COVID infections worldwide. Joining us now to talk more about the nation's vaccination efforts is Jeffrey Shaman. He is a professor of environmental health sciences at Columbia University. Professor Shaman, welcome. Great to have you with us. So you were part of a group of researchers who created coronavirus projections related to herd immunity over the next few months. And one of the things noted in these projections is that vaccines alone are not the answer to ending the pandemic. Why is that? Because I think a lot of people thought that, once the vaccines were on the scene, we would be okay. So what should we be doing to make sure we can reach herd immunity successfully?
Well, in some sense, we're looking at a race between the virus and the vaccine. We would like to get the vaccine out as quickly as possible, and that's a question of production, distribution, and administration. We have to get it into people's arms before they actually encounter the virus and are infected and are at risk of hospitalization and death. Right now, the U.S. is still getting 100 to 200,000 cases per day. As you just said, there have been over 3,700 deaths yesterday. So the virus is really moving at a very rapid pace. And if we relax on the non-pharmaceutical interventions that we're using, the mask wearing, the social distancing, the restrictions of mass gatherings, we're going to allow the virus to pick up its pace. And it's going to accelerate and move through the population and infect more people before we can get the vaccine into people's arms. So the idea right now is to batten down the hatches, is to take a long view and say, we're not going to really get through this into a post-pandemic phase until the beginning of summer, most likely. And we need to control the virus as best we can using those non-pharmaceutical interventions so that we can get the vaccine into people's arms before they encounter the virus.
And I'm curious about your concerns over these variants, because earlier today, the CDC chief said more than 500,000 people could die by February 20th, which is really right around the corner if we don't change what we're doing. And this comes, of course, as we're seeing these more highly contagious variants of COVID-19 popping up in the U.S. How will these variants affect the country's vaccination efforts? Do we need to get the vaccine rollout ahead of the variant spread? And what could we ultimately be dealing with if we don't get ahead of this?
Yeah, it is unfortunately a complicating factor. In particular, if we look at the UK variant, that one, there's really good evidence that it is more transmissible. That means the average person can pass it on to other people with greater facility. It means it's going to spread more rapidly. We've seen that in a very well-documented fashion in the UK, where they're really monitoring it well. As this virus, new variant, comes in and takes over in places, it may give a little bump to the whole transmission of the virus. It make it more difficult to control, unfortunately. And that means that race between the vaccine and the virus is going to be even harder, and that we may take a little bit more of a hit in terms of the number of cases that we see and the number of people who are hospitalized and unfortunately dying.
Now, in terms of fighting the variant, Regeneron Pharmaceuticals announced that its antibody cocktail is effective against the COVID variants that were first identified in the UK, and then another one that's in South Africa. The study was also backed by research from Columbia University. Can you further explain the findings and what these findings could mean in the fight against the coronavirus? Are they effective against other variants? Because we know there's the UK, the South Africa, there's the Brazilian, possibly many more. Would this, be strictly a treatment for variants, or could this be used for preventative measures before people are infected?
Well, there's a lot to unpack there. And so we have a couple variants that are of concern right now, the UK one and the South African one. The news from Regeneron is very good because their monoclonal antibody cocktail is used as a treatment, and it can also be used as a prophylaxis or a preventative, almost like a short-term vaccine in some regards. In addition, we know that the Pfizer and Moderna vaccines, both of them have put out information that indicates that they can bind and offer protection against both variants, though the South African variant, not as well. The question really is, all right, we have these variants that have emerged, and we have some vaccines and some pharmaceuticals that help us deal with it, both in terms of prevention and treatment. But there are going to be new variants that arise. And will one of them escape? In other words, will it evade those medicines that we have right now? And will we have to build new vaccines? I know some of the vaccine manufacturers, Moderna says they're already looking at this, and I imagine Pfizer is as well, to come up with new mRNA components to put into a vaccine that could act as a booster that they would give to people to protect against new variants, very much the way we get flu vaccines every year, where we're going to have new boosters to protect us against it. And that's going to also go for things like the treatments that Regeneron offers. If there's a new variant that comes out for which their current monoclonal antibody is no longer effective, they're going to have to spin, pivot, and come up with a new combination that is effective against that, produce it, distribute it, and get it out there for use.
A lot of work ahead, a lot of monitoring, a lot of tweaking. Thank goodness we have, the best sort of public health, doctors and health officials on this. Jeffrey Shaman, Professor Jeffrey Shaman from Columbia University, thank you for joining us. We appreciate it.
My pleasure.